It's an ongoing study just out looking at incarcerations.
So let's talk to Jamie Worker, who's joining us. She is the Senior State Policy Coordinator. She analyzed how policymakers can protect people and families impacted by incarceration. Jamie, thank you so much for joining us. How is incarceration different in the Midwest, and how is the virus impacting our area more than others?
That's right. So as we take steps to protect the health and safety of our communities during the coronavirus pandemic, we should also remember that our communities include people and families impacted by incarceration. And that includes people in jails, prisons, immigrants in detention centers, and many more people on parole and probation who often need to meet in-person supervision requirements. And in the Midwest and elsewhere around the country, we see states incarcerating more people than many other wealthy democracies around the country. All states in the Midwest have seen a dramatic increase in incarceration over the last 40 years. Racial disparities in incarceration are particularly experienced by Black people, who are overrepresented in jails and prisons in every Midwestern state. And in many states, people from Latinx communities and Native American or indigenous communities are also overrepresented. And these are the same people who face, from the same communities who already face barriers struggling to make ends meet and put food on the table for their families, while also facing barriers to receiving necessary medical care, resulting in chronic health conditions such as diabetes and lung disease that make people particularly vulnerable to the dangers of the coronavirus.
And Jamie, in Cook County especially, I know the sheriff has talked a lot about how the jail has become, in his mind, the largest mental health provider in the region. Is that a big factor when we look at overall incarcerations, just folks with mental health issues that can't get help or medicine anyplace else?
That's right. Yeah. So in the last 40 years, we've seen in rates of incarceration increase as a result of things like mental health issues and drug addiction as well. And that's a perfect reason, why we should be able to prioritize release for people who are facing such issues and can receive treatment elsewhere.
And this, of course, is adding to the disproportionate amount of positive virus cases in the Black and brown communities. Jamie, how do we change that? How do we protect them and the workers at these jails?
Right. Yeah, so it's very clear that we must do more to protect the health and safety of people impacted by incarceration and the staff at these facilities as well. And we can do this by providing necessary medical care and sanitizing supplies and masks at no cost to people who are incarcerated and staff who work at these facilities where...
Well, who pays for that, Jamie? The state or the county or who pays for that?
Right. So, both at the state level resources are needed, and additional federal aid is also needed as well to support communities, because we're only as safe as the people who are most vulnerable among us. And for various reasons, because of overcrowding in prisons, physical distancing, and self-quarantining is impossible. And it's not just true that during the coronavirus that inadequate medical care and access to treatment has deteriorated over time.
Jamie Worker from the Economic Policy Institute, thank you so much for joining us with the results of your study.